So I want you to take your straw and breathe through it normally.
Rachel McIntosh-Kastrinsky is demonstrating how it feels to have asthma.
Now I want you to pinch it a little. Can you guys feel the difference?
Yeah.
It's a lot more difficult to breathe.
She is manager of the Clean Air Carolina program, Medical Advocates for Healthy Air. And this is a practice session she gives to medical professionals on how air quality affects health. Bad air quality can make asthma attacks worse, but people with asthma aren't the only ones who are at risk.
The environment is going to affect everybody.
The environment Rachel is talking about here is the atmosphere, sullied by tiny particles of pollution created chiefly by burning fossil fuels. If inhaled, the smallest of these particles are nasty stuff.
They cross into the blood, and then they can wreak havoc throughout your system. They can activate receptors in your airways, causing nervous system, heart issues, diabetes.
In the United States, it's probably about 100,000 deaths a year caused by outdoor air pollution, both fine particulate matter and ozone. That's about 1 in every 26 deaths.
Jason West is an environmental engineer at UNC Chapel Hill. His lab studies how climate change will affect air quality.
We think that climate change is expected to make air pollution worse in the future.
That's in a business-as-usual scenario where we keep burning fossil fuels. But if we all switch to renewables, air pollution would go down, which makes sense for human health and the economy.
The value of those lives saved just by improving air pollution outweighed the cost of reducing greenhouse gas emissions in the first place.
To hurry along this transition, Rachel sees health professionals as powerful allies. She gets them up to speed through the Medical Advocates for Healthy Air program. It's also an advocacy platform for respected community leaders like retired ER doctor Bob Parr.
You are what you breathe, and if you breathe clean air, as much as you can, you're going to live a lot longer, you're going to be healthier.
Bob attends public meetings to provide a medical perspective in discussions of climate change.
I never knew that I would be much more effective by helping to clean the air than to temporarily take care of people and send them back to dirty air.
We have some pediatric residents that go through advocacy training at the hospital.
Dr. Aaron Levy has stopped by the Clean Air Carolina offices in Charlotte to pick up some new literature for teaching residents at Levine Children's Hospital about environmental health.
And our medicines are a little bit more reactive, and so it's important to me to think about the ways that we can be proactive.
Armed with this new knowledge, Aaron has also joined the Mecklenburg County Air Quality Commission, the only pediatrician to do so. And it's had an impact on his own life.
When I'm exercising by cars or by heavy traffic, I can smell the fumes, I can feel them in my lungs.
Instead of walking his dog, Jack, on the road near polluting cars, Aaron now tries to walk exclusively in parks. There he can relax and breathe a little easier. For Clean Air Carolina, I'm Miles O'Brien.